It is not well understood how high blood sugar, which is the hallmark of diabetes mellitus, causes cardiovascular disease, but there is an understanding that the elevated blood sugar damage the lining of the vessels, increasing the risk of plaque formation inside those vessels, which eventually turn out into a heart attack. The damage can happen just because of the excess of sugar itself. Insulin is a hormone that our body produces to help the cells trap the glucose or the sugar inside them so they can work and function. When we have too much sugar circulating in our body tends to become resistant to that insulin. Therefore, now we need more insulin, which is secreted from the pancreas, to help those cells obtain the sugar inside them. If this problem continues, eventually your pancreas won't be able to produce more insulin, and that's when you develop diabetes. So insulin resistance has been linked with the development of cardiovascular disease, especially if we don't do something to prevent that from progressing into diabetes mellitus. We know that patients with insulin resistance tend to be more obese, living more sedentary life, and tend to have higher cholesterol numbers. So if your doctor had mentioned that your sugar is not properly controlled, but you haven't had a definite diagnosis of diabetes, you can do something to prevent diabetes. You are not going to be a diabetic just because you have insulin resistance. You can do something about it. They're not equal, they're not equivalent, but one can progress to the other unless you do something on time. What is the best intervention for management of insulin resistance and prevention of progression of this condition to diabetes? The best intervention is dietary habits. Try to avoid refined sugar in your diet, control the carbohydrates, perhaps control the juices and sugar intake. The second best intervention is physical activity. If you exercise, the American Heart Association recommends 30 minutes a day or at least 2.5 hours a week of exercise to reduce the risk of cardiovascular disease. If you take measures early, your risk for developing diabetes and cardiovascular disease will be significantly reduced.